All right, guys, let's get started. I just wanted to say a huge welcome to today's workshop, Understanding ADHD from Diagnosis to Daily Life. My name is Lugi. I'm one of the care coordinators for the care team at Shift Collab. I'll be hosting today's session, and then without further ado, I would like to first welcome Jennifer. Hello, Jennifer.
Hello, everyone.
She's a nurse practitioner working at Finding Focus. She's currently providing personalized assessment, diagnosis, and treatment services at Finding Focus. Thank you so much for joining us today, Jennifer. Next, we have Kaela, one of our therapists at Shift Collab, who also specializes in ADHD as well. At this time, I'd like to hand it over to Kaela. The floor is yours, Kaela.
Thanks, Logie. So welcome everyone. So awesome to have you all joining us tonight. And for those Blue Jays fans, don't worry, we'll try to get wrapped up before the game starts at 8. So just really briefly, want to just give everyone a little sense of kind of how the evening's going to flow. So we're going to start off with Jennifer in a few moments, who's going to walk us through a bit of an overview of like, what is ADHD? What can it feel like? What can it look like? If we're looking at sort of going through a diagnosis process or we've just been through one, kind of what we can expect, and a bit of an overview of what some of the treatment options can be. I will then kind of pop back on and take a little bit of time to explore together what therapy can feel like when we have ADHD. If you're coming to therapy and you're either looking for support around ADHD or are looking for support with other stuff and have ADHD, what can that support look like for you? And I'm also going to show you a few tools that can really work in sort of navigating some of the day-to-day challenges that come with ADHD. And then, of course, we'll have a few minutes at the end to just go over a few questions, should any be coming to mind at the end of our time together. So to get us, oh, that didn't work. To get us sort of grounded and settled in today's workshop, I just invite all of you to take a minute to kind of check in with yourself, see which guinea pig really speaks to you and resonates with you. So, looking at our 9 guinea pig options here, how are you feeling today? You could just put in the chat the number that you're kind of identifying with today. And since I have the floor, I'll just say out loud, I'm a bit of a 6, I think. Just feeling pretty happy to be here with you all this evening. Looking forward to the baseball game.
I feel like I'm more of a 9. I'm a little cold. Yeah,
I'd like to be any of these guinea pigs. They all look like they have pretty good lives, I think.
they do. They do. And they all look pretty comfortable as well.
Exactly.
We have a 4. We have a 6 from Jordan. Kathy from Toronto says 5. Angela says 4. 6, 9, 9, 9. Quite a few nines. 6. So everyone's mostly we have sixes and nines.
I love it. I love it. No one's a 3. No one's eating dinner with us this evening while we chat.
Oh, we have a 7.
Oh, amazing. Amazing. Well, thank you all for taking a minute to check in and also thank yourself for taking a minute to kind of notice how you're showing up in this space this evening. And Jennifer, I'm going to pass it off to you as we move forward into kind of, the point what that we're all here for, talk about ADHD.
Amazing. Thank you so much for that. And I felt like a 4, by the way. Just, I thought it was cute. So I figured I resonated with a 4. So, moving forward in terms of ADHD, ADHD, as we may all know, is a neurodevelopmental condition. And so, meaning it really originates in the brain development, and affects how a person manages their attention as well as their regulation and their control. And so, it's not just simply about being distracted or hyper. It's really about how the brain, the networks communicate and regulate. And so, in terms of the effects, again, the key networks that are affected in the brain, attention regulation is number one. And so, challenges in sustaining, shifting, prioritizing focus is definitely a concern for these individuals. Individuals may also focus intensely in one task. So the hyper focus, right? And also struggle to stay engaged with less stimulating or other tasks that they feel less aligned with, so less interested in. Sometimes more mundane tasks. When it comes to executive function as well, there's impact on planning as well as organization, task initiation, and working memory. And so this leads to procrastination, forgetfulness, and as well as difficulty with completing multi-step approach tasks. Emotional regulation is also another network that's affected. And so heightened emotional intensity and difficulty with modulating frustration or disappointment. So quick shifts in mood really, and often misunderstood as overreacting rather than a regulation challenge. Thank you. So in terms of this slide here, this is a word cluster. And in terms of what patients will, or people in general, will say whenever they, or think of whenever they think about ADHD, these are some of the words that came to mind. So this word cloud represents common associations and perceptions people have when they think about ADHD. You'll notice words like attention, as well as hyperactivity and disorder, learning, and behavior. And they appear predominantly, which reflecting on ADHD is often viewed through the lens of symptoms and challenges. So while these terms capture parts of ADHD, they don't tell the full story. That's for certain. So ADHD is not just a behavioral issue. It's again, a neurodevelopmental condition that's rooted in brain function and regulation. And so the goal is to move beyond seeing ADHD as a problem and instead understand it's a difference in how the brain processes attention, motivation, and emotion. Next slide, please. Okay, so in terms of this slide here, these are observable symptoms that we often see and hear about when we're discussing ADHD, behaviors that tend to stand out in school as well as work and in home environments. So individuals may appear not to be listening or seem distracted or forget responsibilities. But these behaviors are rooted in neurological regulation challenges, not laziness, and not a lack of effort. Symptoms often fall under three domains. It's really about the inattentiveness, as well as hyperactivity and impulsivity. And we'll speak a little bit more about that in the following slides. When it comes to the ADHD iceberg is what we call it, what you see versus what you don't see. So the iceberg visual reminds us of what's visible, like the fidgeting, like the daydreaming or interrupting. And it's only really a small part of the ADHD experience. So beneath the surface, there are deeper, often hidden struggles, and this includes emotional dysregulation, so the mood swings, the frustration, anxiety, and the executive dysfunction, poor sense of timing or prioritization, losing or forgetting items or tasks. And then we have the internal restlessness and also mental fatigue, even when someone appears calm on the outside. So many adults, especially women, they mask these internal challenges, which leads to often a misdiagnosis or under recognition. So while ADHD can look like restlessness or inattention on the surface, underneath, there's really a complex interplay of emotional, cognitive, and executive regulation challenges that impact day to day. Next slide, please. Awesome. So when it comes to executive function, it's often described as the brain CEO. It's the part of the brain that's responsible for overseeing things like decision making, organization, as well as planning. So it helps us manage our tasks efficiently. And it's what allows us to connect intention with action, to know what needs to be done, to start it, to stay on task, and to finish it. When it comes to information management, this involves retrieving and using information when needing, like remembering what you read earlier or recalling steps in a process. People with ADHD often have difficulty holding or applying information in real time, which can lead to frustration and errors. When it comes to forward thinking, executive function helps us reflect on the past and anticipate the future. So, for example, learning from a mistake or planning ahead, and using that prior knowledge to inform our present. And so there's often the word time blindness. ADHD can make the process harder because time blindness makes it difficult to make sense of how long things are actually going to take. So the ability to foresee the management of a task and the time dedication is often blind. When it comes to organization and prioritization, this skill helps decide what tasks need attention now and what can wait. For individuals with ADHD, all tasks feel equally urgent at times, so making prioritization a struggle. When it comes to working memory, think of it as your brain's internal compass or GPS system. It's guiding actions and helping people stay on track with multiple steps. So with ADHD, the system is less efficient. So multitasking, following directions, and holding thoughts while problem solving can be more difficult. And in terms of the impact of ADHD, for many with executive tasks that require more mental energy. They require more self-control as well as effort than our neurotypical individuals. So even simple tasks can feel overwhelming. They can feel exhausting. And it's not due to lack of motivation, but it's due to the neural inefficiency of these networks. Next slide, please. Wonderful. So in terms of diagnosing ADHD, it's not based on a single test. It's a comprehensive process that looks at multiple sources of information and that is consistent with the DSM-5 criteria. So the goal is to understand how symptoms show up, really and truly, how long they've been present, which is really important actually, and how they affect daily life across multiple domains. So for instance, if somebody is having challenges with their workplace, but they're not exhibiting the same challenges at home or in academics, then that it's not consistent. It might be the job in itself that just doesn't align well with that particular individual. Typically, symptoms will appear in multiple domains. When it comes to comprehensive evaluation, this is really the assessment that starts with a detailed clinical interview. And this would be exploring developmental, academic, and psychosocial history. When it comes to clinicians, we do use some standardized tests and tools and behavioral questionnaires that will help assess, and we're looking really for patterns of attention, organization, as well as impulsivity. And we tend to use multi-source input. So information is gathered from multiple perspectives. It can be the individual themselves. It can be a family member. It can be a workplace supervisor, for instance, or teachers. And so this ensures that the symptoms are, again, consistent across all environments, not just situational. When it comes to symptom domains, again, we kind of briefly touched upon the domains, and we will discuss them a little bit further, but the inattentiveness, the hyperactivity, as well as the impulsivity. These are all the three big bucket items and categories really for these symptoms. Individuals may present predominantly as one or the other, or a combined type presentation as well. When it comes to functional impact for a diagnosis, symptoms must interfere, again, with functioning in at least two domains. So let's say, for example, in their personal life as well as school, or it could be at school and at work, but at home, it could be less so of a concern, but still symptoms are generally present. So the focus is not on necessarily on impairment. It's not just the presence of symptoms, but how ADHD affects relationships as well as performance and self-esteem. So in terms of ruling out other causes, that is definitely something that always should be done. So it's essential to differentiate ADHD from other conditions because they can also either coexist or they can mimic ADHD. And that would be disorders such as anxiety, for instance, mood disorders, thyroid dysfunction as well, or sleep disturbances, substance use, and binge eating disorders. All of these can also coexist with ADHD, but it can also be something that's mimicking. So again, important to differentiate. Next slide. Wonderful. So a thorough ADHD evaluation involves multiple components. It's structured to ensure accuracy, ruling out other conditions, and capturing the individual's real-world functioning. The process goes beyond checklists. It's really about building a full picture of the person's cognitive, emotional, as well as their behavioral profile. So the clinical interview is definitely the foundation of the assessment. This is where we're really exploring developmental, medical, psychiatric, and family history. So clinicians will look for patterns of attention difficulties, impulsivity, and issues with regulation across time. And generally, these will begin in childhood. So this helps distinguish ADHD from other conditions that can be causing issues with concentration or mood symptoms, such as stress or anxiety. When it comes to some of the standardized tools that we use, there is the ADHD self-screener, self-report scale, ASRS. This is a screening tool, and it's pretty valid, actually, in terms of its validity. It's very sensitive. And so whenever we do administer this test, if it does show up as positive, the likelihood is, again, ruling out other conditions, but the likelihood is generally there. When it comes to the WFRS, which is the Functional Impairment Rating Scale, this measures how ADHD impacts everyday functioning at home, work, and in our relationships. The PHQ-9 and the GAD-7, they also they screen for coexisting depression and anxiety, which can also frequently be an overlapping diagnosis in itself with ADHD. So these tools help us to ensure that it's structured. These are all evidence-based, rather than relying solely on subjective impressions. So the collateral information, we kind of briefly spoke about that. So we're just, again, multiple sources will definitely provide you with that validation, that data, external perspectives. In terms of physical examination and labs, not always required. But in my own practice, for instance, I do ask, when was the last time you seen a practitioner? When's the last time you had some blood work done? Because sometimes it could be a multitude of different issues, let's say thyroid dysfunction, or anemia, or vitamin deficiencies, or sometimes substance use or lack of sleep that can be compounding the issues or the symptoms that patients are experiencing. So in terms of the next slide, wonderful. Okay, so the DSM-5 criteria, this is part of the reason why I was holding off on explaining 3 different categories, because this slide actually is a really good slide that depicts what happens with each. So inattention, hyperactive, impulsive, and then we have the combination type. These categories help clinicians understand the dominant symptom patterns, though many individuals experience really do overlap with all the 3 domains. ADHD symptoms must be persistent, they must be impairing, and developmentally inappropriate, meaning that they go beyond what you would expect for another individual's age or situation. ADHD inattention is really, this is less visible, especially for women. So adults, females that are in their adulthood, that's generally when they start to become diagnosed, studies will show, because Inattentiveness, you're not necessarily being a problem. You're not being flagged in school, for instance. Whereas males, for instance, at a younger age, they're flagged because they're hyperactive, impulsive. They may be causing some disruption, for instance, in the classroom setting. And so they do, therefore, get an assessment and then diagnose as a result. Whereas female counterparts, especially the inattentive presentation, generally is just flying under the radar. Thank you. And here's the risk about not being diagnosed. ADHD is not just a childhood condition. It's a lifelong neurodevelopmental disorder that affects functioning across every stage of life. So when left untreated or unrecognized, ADHD can really lead to emotional as well as academic and social consequences. So this slide really illustrates the progressive impact over time from early behavior and learning challenges to adult mental health and relationship difficulties. In the preschool years, we have symptoms that often appear as behavioral disturbances or emotional dysregulation. And the increased risk of basically unintentional injuries can also be a focus in this age group because the poor impulse control and risk-taking behaviors. Parents may feel ineffective or blamed, leading to a lot of family stress and guilt. In the school-age child, academic impairment becomes more evident. So difficulty with following instructions, as well as completing assignments and staying seated. So social challenges also arise as well during this stage. In terms of adolescence, the transition to adolescence brings new pressures. We have independence, we have social hierarchies, we also have academic demands. And so without treatment, youth are at risk for academic underachievement or low self-esteem, peer rejection, antisocial behaviors, as well as substance use, right? And usually a form of a coping mechanism, self-medication. When it comes to the college age adulthood, right? If it's not treated, if ADHD is not treated, it can potentially end up with academic failure or dropping out. Also difficulties on the job due to poor organization as well as time management skills, injuries or substance misuse from impulsivity or stress, and poor coping strategies. And many students experience burnout. And they can also be mislabeled as being unmotivated, when in fact, they're really just overwhelmed by executive dysfunction. When it comes to adulthood, the consequence persists and it often compounds. So we have mood instability as well as relationship problems, chronic low self-esteem from years of perceived underperformance, also increased risk of accidents, job loss, alcohol, substance misuse, and we have challenges with parenting consistency, emotional regulation, and organizational demands intensify. So when ADHD isn't recognized or supported, the challenges grow with age. But with proper diagnosis and management, outcomes improve drastically and across every stage of life. Effective ADHD management requires a multimodal approach, combining psychosocial interventions, lifestyle strategies, as well as pharmacological treatment when indicated. So the goal is not just symptom reduction, but it's really to improve functioning, confidence, and quality of life. When it comes to psychosocial interventions, cognitive behavioral therapy is evidence-based and it helps individuals identify as well as reframe unhelpful thought processes that contribute to procrastination, the feeling of overwhelm, as well as low self-esteem. ADHD coaching and counseling provides structure, accountability, and it also tailors strategies for daily living. And I'll definitely let Kaela speak to that a little bit more. When it comes to lifestyle strategies, this is the foundation. Self-care is absolutely the foundation to a lot of different parts of our life, but it's very significant. It's a significant influence in ADHD symptom control and also medication effectiveness. So sleep hygiene is crucial. When mild sleep deprivation worsens, it will worsen attention as well as the ability to self-regulate. Regular exercise, it boosts dopamine as well as norepinephrine, which is actually what patients with ADHD are deficient in. And so it improves the ability to focus and mood. Balanced nutrition helps stabilize your energy as well as concentration. It's really nourishing the brain. And so encouraging structured daily routines, it can definitely also be a helpful strategy because it will help be predictable in terms of your schedules. It will help reduce decision fatigue, as well as that load, that cognitive load that we spoke about earlier. Nutritional supplements such as omega-3, fatty acids, as well as zinc, vitamin D, B complexes, L-theanine. It can also be helpful as an adjuvant, although evidence is variable and should be really individualized. Vitamin D, kind of a non-negotiable though, and the studies have actually supported omega-3 fatty acid use as well. When it comes to pharmacological treatment, medications remain the cornerstone of moderate to severe ADHD. So when symptoms are impairing your quality of life and your daily life, and again, in that multiple domain field, stimulants such as amphetamine or methylphenidate-based are the first line, and they target dopamine as well as norepinephrine pathways to help enhance focus and impulse control. When it comes to non-stimulants, these would be, for instance, atomoxetine, otherwise known as Strattera, and guanfacine Intuitive is the other name for that. And so they're really alternatives for those that have contraindications or have side effects for stimulants, for instance. And oftentimes we actually do use them as a combined therapy, and it works like a charm. The aim is really functional improvement. So not sedation or personality change. The medication helps support the brain to work as it's intended. So managing ADHD effectively means treating the person as a whole, building habits, developing strategies, and using medications when needed to create a brain environment where focus, motivation, and regulation can thrive. So medication is not the only treatment for ADHD. It's part of a comprehensive and individualized plan. So the decision to start medication really depends on the severity of the symptoms and the degree of functional impairment and how well non-medication strategies are working. The goal is really about improving functioning and quality of life, not simply symptom elimination. There seems to be sometimes a misconception about that. So I just wanted to make sure that that was also part of this webinar. When ADHD symptoms are significantly disrupting daily functioning, and it's interfering with academics as well as work or relationships, medication should be considered at that point. So for example, when you have chronic missed deadlines, or you have poor academic performance despite putting in effort, or frequently being disciplined at work or at school because you've had some issues with not meeting the standard. These are reasons why you might want to consider medication. When behavioral or psychosocial interventions aren't enough alone. So strategies, again, cognitive behavioral therapy, I can't stress that enough. Kaela will as well. Coaching and as well as structured routines, essential. But for many, they don't fully address the neurochemical regulation issue. So this is why medication can be helpful. And to manage core ADHD symptoms directly, these medications target, again, it's a deficiency in norepinephrine as well as dopamine systems. It will help with improving your attention, impulse control, as well as the ability to self-regulate on an emotional level. It will help with distractibility as well as impulse decision making and task initiation difficulties. When ADHD-related behaviors pose safety risks. So this would be risky behaviors such as risky driving, for instance, unsafe sexual practices, or poor decision-making overall. Medications can definitely be helpful. When symptoms cause emotional distress or relationship strain, untreated ADHD can often lead to frustration, as well as low self-esteem and chronic overwhelm. So medications can help with emotional dysregulation and improve mood stability, which in turn helps strengthen the interpersonal relationships as well as confidence. So again, medication doesn't change who a person is. It supports the brain in functioning as intended. So when combined with therapy and lifestyle strategies, it helps individuals focus their energy on thriving and not just coping. ADHD is highly manageable, but only when it's recognized and supported. So when individuals struggle silently for years, believing their challenges reflect a lack of willpower or motivation, when in reality, they stem from neurological regulation differences. So this slide really helps highlight when it's time to reach out to a healthcare provider for professional evaluation and for ongoing support. It's when you have difficulty with managing attention, time, and emotions despite having effort. It's that chronic frustration as well as guilt or burnout, and you have that pattern persist. It's those persistent issues with performance or relationships. This would be in the form of missed deadlines, conflict, forgetfulness, disorganization. Again, treatment can definitely help with pharmacological interventions. Emotional dysregulation or frequent burnout. So these would be the emotional mood swings, the low frustration tolerance, or exhaustion from constant self-monitoring are common in ADHD. So recognizing that emotional dysregulation is part of ADHD, it helps remove the stigma and it helps promote appropriate care. Seeking evaluation clarifies what's happening. A formal ADHD assessment can definitely differentiate between ADHD, anxiety, depression, and other causes of executive dysfunction. I can't tell you how many times I've had a patient overwhelmed and just beyond the moon because they finally understand that, some of the symptoms that they've had their whole entire lives is attributed to an actual diagnosis. So again, reaching out to a variety of professionals, whether it be your fellow nurse practitioner, psychiatrist, psychologist, or therapist, ADHD coaches who specialize in structuring, as well as the accountability piece and the practical skill building piece. Oftentimes, it actually does take a multidisciplinary approach, okay, and a multifaceted approach to the treatment. So seeking support is not about weakness. It's about gaining clarity. And the tools and the right team to help the brain work for you instead of against. And now actually, sorry, I have one more slide. So ADHD is one of the strongest genetic links of all the developmental conditions. It's not a personality trait. It's not a parenting issue or behavioral choice. It's a inheritable brain-based condition that runs in families. If I had $1 for every single time I heard a patient say, I think my dad is like that, or I think my mom presents like with these symptoms, but we just kind of normalize it in the family. Undiagnosed can also be the case as well. So genetic influence. Research actually consistently shows that ADHD is highly heritable. So with genetics accounting for roughly 70 to 80% of the variance in who develops the condition, this means that if one person in the family has ADHD, it's important to be aware of the potential for symptoms in other relatives. So whether that be siblings, parents, and children. It's also common to see generational patterns. So, where adults are diagnosed only after their child receives an ADHD diagnosis. Seen that a bunch of times as well. Increased risk in families. First degree relatives, specifically. So, this would be your siblings, your children, your parents of an individual with ADHD are 5 to 10 times more likely to also have ADHD compared to the general population. It's pretty strong in terms of the numbers. This familial clustering actually highlights that ADHD is not isolated. It coexists with shared environments and genetic factors such as emotional regulation patterns, as well as stress responses and sleep tendencies. When it comes to specific probabilities, and you can reflect that chart right here, the 57%, the 55, and the 32. There is a 57% chance if a parent has ADHD that you may inherit it. There's a 55% concordant rate as well in identical twins. There's a 32% rate or chance of twins that are fraternal twins or siblings. So again, these are pretty strong numbers. Recognizing ADHD as a genetic and neurological condition helps shift the conversation from blame to understanding, which allows families to approach support with empathy, awareness, and early intervention. Now off to you, Kaela.
Had a trouble unmuting myself there. Thank you so much, Jennifer. Really appreciate you taking the time to go over all that with us. So I'm going to take the next little bit of our time together tonight talking about, what's it like to explore therapy when we either have a diagnosis of ADHD, when we have a family member who has ADHD, or if we're curious that we might have ADHD. So therapy is really customized in order to address the unique set of symptoms related to ADHD that each individual identifies finding most challenging. So in therapy, we might take time to deepen our understanding of how ADHD feels impactful or challenging for you. And we would also take the time to explore and learn practical tools and strategies that you can use to deal with those symptoms day to day. So before I jump more into this and give you more information to kind of ruminate and think on, let's have a little check-in. So what are some things that ADHD can make feel extra tricky or challenging for you? So I invite you to just pop into the chat and oops, I move forward, pop into the chat and just share, one or two words or kind of the key pain point or the most tricky bit that you've noticed about your own experience or the experience of a loved one. Yeah, studying. Totally. Absolutely, Jordan. Timing, being on time, for sure. I know Jennifer kind of mentioned time blindness earlier. Absolutely. Yeah, totally. Alicia, house chores and organizing, decision making, listening, motivation, prioritization, consistency, work as a teacher. Oh my goodness, I don't know how teachers do it in general. I totally hear you. Brain fogginess, time blindness, absolutely. Absolutely. All of those challenges that you've shared make so much sense within the context of ADHD. And as I mentioned in the previous slide, oops, I flipped slides again. Sorry about that. Oh no, what happened here? I don't know. It's going backwards on me now.
If
That's
you want,
so weird. I'm
if you
not
want
sure.
to, at the bottom,
Oh, uh-oh. Sorry, everyone. Oh no, hold on.
Okay,
Little
take your time.
little techie. Where were we? There we were. One more. And then how do I do this now? There we go. Okay, can folks see it again? Okay,
yeah,
amazing. I
Work.
don't know what happened. I apologize for that, everyone. Doing too many things at once. Sorry, Loki. Thank you.
no problem.
So, okay, recenter. So, as I was saying, so all of what you shared Totally makes so much sense. Thank you so much for taking a minute to share that with all of us. And I'm sure, as each of you were writing in the thing you find most tricky, I'm sure everyone else was sort of like, yeah, me too, even though you might have all been offering different things that you felt comfortable to share. So as I mentioned in the previous slide, before all the slides just flipped without my knowledge, ADHD has absolutely a set of common symptoms associated with it. At the same time, how those symptoms present or impact each person is incredibly individual and unique. And so where therapy is super helpful is that we can sit down one-on-one and really deep dive and explore together, like, what's your most tricky thing? And we can create plans and explore strategies and tools that are really going to work for you to meet your own unique needs. So now hopefully the next slide shows without flipping all the way. Haha, yes, excellent. Okay, so as you can see from this slide, therapy can help with so many different attributes of ADHD that Jennifer took an incredible amount of time sharing with us. So thank you again, Jennifer. There's so much stuff here that we've already named together, right? Like there's emotion regulation, there's coping strategies, we can work on problem solving, we can work on focus building, we can work on building self-esteem, stress resilience, mindfulness, self-advocacy, decision making, right? So therapy can have so many benefits for ADHDers. Perhaps you have a new diagnosis. Therapy can be helpful in identifying and setting personal, professional, or academic goals. Therapy can support you in learning what accommodations might be available at your school or in your workplace and how to advocate for yourself to get the support that you need. Therapy can also help you in improving your communication skills, build routines, improve focus, and explore things like impulse control, like we've already discussed tonight. Think about things like managing tasks and time management. And as Jennifer shared, medication is also a part of kind of all of this too, right? And at Shift Collab, if you were to work with one of the therapists in our ADHD clinic, we don't prescribe or diagnose. However, we're usually like pretty familiar with the different medications that might be prescribed and also always happy to support you in advocating for yourself or exploring those options with your nurse practitioners and your other healthcare providers. So there's, a number of different evidence-informed best practice clinical approaches to, what therapy can look like when we're supporting folks with ADHD. So I'm going to just touch briefly today on a couple of them. If you do connect with a therapist around getting support for ADHD, these might come up over the course of therapy, or you could always ask to hear more about or get curious about any of these approaches. So I think Jennifer mentioned this one earlier, but cognitive behavioral therapy, or CBT, is one of the sort of, most often utilized framework to support individuals with ADHD. And it offers an opportunity to focus on understanding the relationship between our thoughts, our feelings, and our behaviors, and exploring ways to kind of influence one of those areas or make changes in one of those areas, recognizing that there will be a ripple effect or interconnected change all around. Another framework that is often used is motivational interviewing. And in this framework, we support you in building and maintaining motivation through the use of getting curious, reframing our thoughts, and reflecting on times in the past when we have felt motivated with exploration of what helped in those moments. Dialectical behavioral therapy, or DBT, can help us to feel more balanced between our emotional mind and our logical mind. So we explore in that framework, like being mindful moment to moment, explore strategies around emotion regulation, exploring what distress tolerance can feel like and what tools and strategies we can use to tolerate our distress, and to explore tools and strategies related to interpersonal relationships and dynamics. The final one that I'll take a quick moment to mention as well is acceptance and commitment therapy, or ACT. And this framework supports you in making decisions that are based on your values. So we first take time to explore what our core values are, and then we sort of work towards alignment between values, our actions, and our long-term goals. So, we often realize when we start this work, or certainly I often sort of notice this and name this with the folks that I connect with, that we're already using a lot of strategies and tools that we might not even realize are ways of managing ADHD symptoms. So, before I continue to kind of talk a bit about this and offer you all some tools tonight, I just want to invite you to take a minute to share in the chat, like what strategies or tools or supports are you already using that you think are supporting you in navigating ADHD in your own life or with your loved ones? And hopefully when I do this again, I'm not going to flip through all the slides.
Jennifer mentioned her calendar.
Oh, calendar. Yeah. Awesome. Yeah, using technological tools and resources. Absolutely. Whether it's on paper or on your phone or your computer. Writing down everything. Yeah, yeah, yeah. Writing it down. Oh, working with the shift therapists. Yay, shift therapists. Whiteboards. Yeah, keeping track of deadlines. Google Keep, calendars. Some folks might be using things like different apps, timers. Timers are huge. Pomodoro for sure. Yeah. I have I'm not going to share this one in a minute, but creative activity. Oh, having a creative activity helped. Yeah, absolutely. Painting, kind of focusing on something. Using ACT. Awesome. Awesome. Yoga, therapy, journaling. These are all so many incredible strategies. You guys are all already doing so many incredibly skillful things. So wonderful. So, so wonderful. And this is what I expected. You're already doing incredible, skillful things to support yourselves and your family members while you navigate so many of the challenges that can show up when we have ADHD. So amazing. Okay, good. I didn't slide through all the slides again. Okay. So I'm going to take a few minutes. I know we got a few minutes left, so I'm not going to kind of dive too deep, but I did want to make sure I didn't miss the opportunity to share a few super accessible, fairly easy to use tools that you all can kind of start using as early as right now. So Logie's going to put in the chat, and he just did. So if you go into the chat, you can click on the link. It'll take you to the next three slides. Well, not the slides themselves, but the three tools that are on the next three slides that are also available on our Shift Collab website. So if you're ever looking for more tools, there are more on there. If you go to the ADHD clinic button at the top of our webpage, scroll down to close to the bottom, you'll see there's like an orange button that says tools. If you click that, there's about 7, 8, or 9, I'm not sure even. Like there's a ton of awesome tools and handouts and resources there that you can access anytime you need. So to start us off, I just want to take a few minutes to talk a little bit about the priority matrix. So I know Jennifer mentioned this earlier as well, just this sort of like the ways in which ADHD and, the ways it impacts our executive functioning can make it hard for us to prioritize. Everything feels urgent. Everything feels like it needs to be done yesterday, never mind right now. And that can get really overwhelming. And so this is a really cool tool that can help us to turn our to-do lists into a really kind of planful, actionable, literally like map and process. So what we would do is we would sort of take that list of items. I think a couple of you mentioned that you write stuff down and go through each item one at a time, thinking about where within these 4 boxes it fits best. So for example, I'm going to take a couple minutes. I want to give you just like a little example to demonstrate how we could use a tool like this. So imagine that you're a law clerk working in a legal firm. And you feel like just like appreciating the work keeps piling on, piling on, piling on. You're feeling really overwhelmed. And this is also kind of spilling into your personal life. You're feeling like you're coming home really drained. You're not doing things around the house that you might typically get done. And things are just feeling like a lot. You're feeling burnt out. You're feeling overwhelmed. So we're going to start by making a little list of the things that we know we need to get done. So first on that list is we have an affidavit that we need to finish writing for tomorrow. We know that our apartment needs to be cleaned. We have a friend that keeps texting with some drama that's going on. We have our therapy homework that we still need to do and keep putting off. We realize, oh my gosh, don't think I've eaten all day. Like the day's gone by so fast. I'm not sure if I had lunch. We have a TV show that we're binging on Netflix that we cannot wait to see what happens next. We have laundry that's kind of sitting around. And on top of all of that, one of the lawyers that we work with just walked by and piled a huge pile of legal documents on our desk, and they need to be reviewed over the next week. So we're going to take this list of stuff. I don't know, are you guys, I'm feeling a bit overwhelmed just saying all of that. So, it's a lot, right? So we're going to take a minute, take this list, and we're going to talk about where we plug it in. So when we think about our first box on the top left, the do first box, urgent and important. So, probably going to put the affidavit that's due tomorrow in there. These are things usually that have a deadline, especially like a timely deadline, maybe something that's a bit of a crisis or a basic need. So we're going to put the affidavit in there. We're going to put in there as well. Probably should eat something. I become a very grumpy bear when I haven't eaten. So let's eat something because probably that's going to help us feel much better in general. And then maybe this drama that the friend is texting about needs a little bit of quick attention because they're really kind of spiraling. So maybe we're going to send like a little encouraging, supportive message back to our friend. The next box, which is our schedule. So it's not urgent, however, it is important. Then, we might put in there the legal documents that we need to review over the next week. We're, maybe going to put in there our therapy homework, maybe up to you, no judgment. And maybe we're going to put in there our sort of need to clean our space, right? Recognizing the ways in which again, for myself, I know this is true. I know this is shared with lots of folks. If my personal space isn't cleared, I feel very sort of out of sorts. It can add to my mental unwellness or feeling drained. So I'm going to take some time because that's for my overall health. Then next on the bottom left, we look at delegating if possible. So these are things that might be urgent, but maybe less important. So maybe we're going to message our friend and say, you know what, like I really want to take time to connect with you. Can I call you on my walk home from work later? We might also see like if we live with somebody, could we create a plan to clean the apartment together? And finally, in our eliminate or reduce, these are things that are not urgent and not important. So I'm sorry to say Netflix binge watching might go in that box. We might also put in that box, scrolling TikTok, or, what we say often like the doom scrolling, the sort of mindless scrolling. We might also put in that box laundry. If we have clean clothes, we don't necessarily need to get that done. It's not urgent and it's not important. So the laundry might go in there as well. So that's just sort of a quick example of how we might turn our to-do list that might feel overwhelming into sort of this organized way of viewing these different tasks with a sense of how we can start, where can we start, and what needs to be attended to first. The next tool that I'm going to share with you is our time management task tracker. So again, this could be used on its own or hand in hand with the priority matrix that I just showed you. So again, I'm not going to go through all of them, but thinking again about some of the tasks we just identified needing to do, you're going to notice here that at the top of the chart, there's the day of the week. So you can map out a whole week if you want. You can map out a couple of days, up to you in terms of how much of the specifics you want to get into or how much you want to do at a time. But what you would do is put, the task name, as you can see here, you would categorize it, identify what supports you need, and then it also has a feature of adding a column to acknowledge if it is or isn't completed. So, we might put in there affidavit, the category is work, the support is maybe like our computer, maybe the notes from a client meeting, maybe a highlighter or a pen if we're on the drafting phase, whatever that might be. And then once you get it done, you're going to put a nice big check mark in there or a big wide, acknowledge that you've completed it. And so again, you would just go task by task, put them on this list, map out your week or a couple of days to help you feel like you're organized and ready to kind of tackle the day. And then finally, this last little tool that I want to show you is our task simplifier. And similarly, it's a bit of it's similar to like an AI bot, but it's really super helpful. So you could put in the box any task that you're looking to get started and having a tough time starting. So you could put in there like do the laundry or clean my room or draft affidavit. And then click Simplify Task, and it's going to populate a really awesome list of smaller tasks that you need to complete to get the larger task done. And then the other thing that's cool about it is you can check off each task as you do it. So again, kind of like, tapping into that reward system in our brain, releasing some dopamine, getting motivated and encouraged as we get tasks completed on the list and checked off as a way to really kind of track our progress and see that we are being productive and getting things done, which always feels so great. Oh, see now I've went forward again. Uh-oh, what did I do?
If you want to just press the arrow backwards, yeah.
It's been very sensitive with me. Okay, I gotta stop touching stuff. Take it away, Logie.
Awesome, awesome. Thank you so much. I just want to say a huge thank you to Jennifer and Kayla for hosting this wonderful workshop today. And thank you so much once again for these amazing tools. I've also sent a link in the chat as well. Um, and with that link as well, there's also other tools also that you might find helpful. On the screen, you can see QR codes. Please scan these codes, take pictures of these, use these codes to book a free meet and greet or an initial session with Kayla.